young woman, 19 years old, an old case, so I apologize for image quality. You can see that there's this humongous mass in the retroperitoneum. It has both cystic and solid components. You can see, and this is kind of coronal T2, coronal post-contrast, just kind of showing heterogeneity of this mass with cystic components. And again, she's 19, and I forget how she presented, but I think she presented with, let me just look it up. She presented with like just, I'm sorry, 1 second. She presented with just pain.
And Victoria, are her ovaries normal? I couldn't see if it's.
So here's her uterus. You can see the left ovaries right here. The right ovary maybe here. Let's see if we can see on coronal. So we had a very difficult time kind of establishing the origin of this thing, but maybe here. You remember, oncologist is a pretty old case.
I have.
There you go.
I have a couple of theories, but one of them, I have a couple of solitary fibrous tumors that look like this. And then I also have a fibroma, but if the ovaries are normal, then no.
So we could not, here's the ovary, the left ovary, here's the right ovary. So we thought this was arising from retroperitoneum and just kind of recommended resection. At least I believe that's what happened. Again, remember, but when the path came back, you can actually see where this thing is arising from, and it's actually arising from the right kidney. Sorry, but you can see it's arising from here, from the inferior aspect of the right kidney, and just this tremendous, primarily solid mass with multiple cystic components. So this is a fairly rare phenomenon, and it's called, this is a mixed epithelial and stromal tumor. So it's a stromal tumor, right? So I guess everything, like things that you've mentioned, like fibrous tumor and fibroma, kind of make sense why this kind of mimics it, because it's also kind of solid and has stromal components. It's a very rare tumor. Usually they're benign, but sometimes rarely they can come back. Classically, they're actually in older women, but this one is a young woman. And so this is what they usually look like, just kind of multilocular cystic thing. And most of them fit criteria for like Bosniak 3. Some of them fit criteria for Bosniak 4. So you can see, but you can see in this case, this was kind of a more solid mass compared to what I found. But this was an interesting case.
Yeah, very cool. Was it? Do you know if the path turned out to be benign or malignant or?
Benign. It was benign mass. So that she's the last imaging we have of her from 2017, and she was fine. I'm sorry. I know you weren't supposed to, but she's this is like 5 years after her original diagnosis. She's okay.
Cool.
All right. So the last case